So in this video we are briefly going to talk about HPV vaccine. So we are not going to go in so deep about vaccines and how it should be taken and how who should take it, when it should be taken, how much the dose is, what are the types. It's very brief. HPV vaccines are actually the recombinant vaccines. That means it doesn't have a viral DNA. It just are the inactivated capsid coat of virus. It looks like, see, it's not the real capsid, but what we are doing, we are copying that protein structure and doing recombination vaccine. Okay, now, so it's completely safe, first of all. Second, when we should give it, it should be started at 9 years. Girls and boys of 9 to 14 years. This age group of teenagers, they are not supposed to have infected with HPV yet. So we are giving only 2 doses, one at 0 and second is at 6 months. If we see that the girls and boys of age of more than 15 years here, then we need to give them the 3 doses, 0, 1 month and 6 month. Now there are 3 basic types of vaccine, and it's like that: the Cervarix, Gardasil and Gardasil 9. Cervarix is a bivalent vaccine. The types covered are 16 and 18. Gardasil is a tetravalent vaccine. It includes 2 more subtypes of 6 and 11. Also 16 and 18 are there already. The newer vaccine Gardasil 9 has come, which includes 9 subtypes. These 4 are as same as Gardasil, but these 5 are added, that is 31, 33, 45, 52, 58. Okay, now all the vaccines are of intramuscular injection of 0.5 ml. What is the ideal age? Ideal is 11 to 12 years in both girls and boys. But the range when it can be given is 9 to 26 years. So after 26 years, there is no rule of giving HPV vaccine. Yes, if the patient or if the person is not yet into sexual activity, even after 26 weeks, then yes, you can give it that time, even after that. But most of the time you shouldn't given after 26 weeks. This Cervarix vaccine is only for girls, but these 2 vaccines are also for boys and girls. Thank you.